Let us have an overview of peripheral nervous system in this video. Peripheral nervous system is made up of nerves and ganglia. There are 12 pairs of cranial nerves and 31 pairs of spinal nerves. Ganglia are further classified as sensory ganglia and autonomic ganglia. Sensory ganglia are seen in relation to the dorsal roots of spinal nerves and in relation to 5th, 7th, 8th, 9th and 10th cranial nerves. Autonomic ganglia are further classified into sympathetic and parasympathetic ganglia. Enteric nervous system, often classified as a third part of the nerve system, is generally considered as a part of peripheral nervous system itself. This is made up of neuronal cell bodies and nerve plexuses situated in the wall of gastrointestinal tract. Coming to the cranial nerves, there are 12 pairs of cranial nerves which can be classified as 4 sensory, 4 motor and 4 mixed nerves. The first or olfactory nerve carrying olfactory sensation, second or the optic nerve carrying the visual sensation, 8th or the vestibulocochlear nerve carrying the hearing and vestibular sensations, 5th or the trigeminal nerve carrying general sensations from the head and neck are considered as sensory nerves. Although the trigeminal nerve also has a motor component supplying the muscles of mastication, so in the true sense it is to be considered as a mixed nerve. Now coming to the motor nerves, the third or the oculomotor nerve, fourth or the trochlear nerve and sixth or the abducens nerve supply the extraocular muscles. Third nerve also supplies sphincter pupillae and ciliaris, which are the intraocular muscles. The fourth motor nerve is the 12th cranial nerve or the hypoglossal, and this supplies muscles of the tongue. Coming to the mixed nerves, the 7th or the facial nerve supplies the facial muscles and lacrimal, submandibular and sublingual glands, but it also carries taste sensation from the anterior 2/3 of the tongue. 9th or the glossopharyngeal nerve supplies stylopharyngeus muscle and parotid gland, but it also carries general and taste sensations from the posterior 1/3 of the tongue as well as general sensation from the wall of the pharynx. 10th or the vagus nerve supplies the muscles of the larynx, esophagus and most of the viscera and glands in the thorax and abdomen. It also carries taste sensation from the posteriormost part of the tongue and epiglottis as well as general sensations from pharynx and larynx. Vagus also carries visceral sensations from most of the viscera it supplies. 11th cranial nerve or the accessory supplies the soft palate muscles and carries the general sensations from the wall of the pharynx through vagoaccessory complex. Coming to the attachment of these 12 pairs of cranial nerves to different part of the brain, the first cranial nerve is attached to the cerebrum, being a telencephalon derivative. The second or the optic nerve is attached to the thalamus, being a derivative of diencephalon. Third, oculomotor and the fourth trochlear nerves are attached to the midbrain, third on the ventral aspect and fourth on the dorsal aspect. Fifth or the trigeminal nerve is attached to the anterior aspect of pons. 6th, 7th and 8th cranial nerves are attached to the pontomedullary junction. 9th to 12th nerves are attached to the anterolateral aspect of medulla oblongata. As you notice, 4th cranial nerve is the only one which is attached to the dorsal aspect. All others are attached to the ventral aspect of the brain. Coming to the spinal nerves, the dorsal root carries the afferent sensations to the spinal cord and its cell bodies are located in the dorsal root ganglion. Ventral root carries efferent sensations away from the spinal cord and its cell bodies are located in the ventral horn of the spinal cord. Both these dorsal and ventral roots combine to form the mixed spinal nerve, which divides into a dorsal ramus and ventral ramus, which are both mixed nerves. In case of thoracic segments and upper 1 or 2 lumbar segments, we also have sympathetic nerve fibers coming along with the ventral root, and they relay in the sympathetic ganglia, and the postganglionic fibers or the gray rami communicantis will either travel with the ventral ramus or with the dorsal ramus. Dorsal ramus supplies the muscles of skin and the back. Ventral rami most often form plexuses, like upper 4 form the cervical, lower 4 cervical and the first thoracic will form the brachial plexus. Upper lumbar nerves form the lumbar plexus. Lower lumbar and upper sacral nerves form the sacral plexus. In the thoracic area, however, they do not form a plexus but remain as intercostal nerves. They supply the ventral body wall muscles as well as upper and lower limbs. So all the 31 pairs of spinal nerves are the mixed nerves. We have numbered them as 8 cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. The area of skin supplied by each pair of spinal nerve is called as a dermatome, and the amount of muscle supplied by a pair of spinal nerve is called as a myotome. Although there is quite a bit of overlap between the dermatomes, we should remember at least few dermatomes for the clinical purpose. Tip of your shoulder has a dermatome of C4 segment. Sternal angle just below that has the T2 segment. At the level of umbilicus, it is T10 segment. Groin region has the L1 segment. In case of hand, the thumb has C6 segment, middle finger C7 segment, and little fingertip is the C8 segment. The medial borders of the great toes has the L5 segment, and the lateral border of the foot has the S1 segment, and the external genitalia region has S2, S3 segments. Coming to ganglia, we know that ganglia are the collection of neuronal cell bodies outside the central nervous system, and they are classified as sensory or autonomic, and autonomic in turn are classified as sympathetic and parasympathetic. Coming to the sensory ganglia, these are made up of pseudounipolar neurons, and within the ganglion there are no synapses. In relation to trigeminal nerve, the ganglion is the Gasserian ganglion or the trigeminal ganglion itself, and that is located in the Meckel's cave in the posterior part of the middle cranial fossa. In relation to facial nerve, it's the geniculate ganglion located within the facial bony canal. With the vestibulocochlear nerve, it's a spiral ganglion located in the modulus of the inner ear. Glossopharyngeal and vagus both have superior and inferior ganglia, and they are located within the jugular foramen. In case of spinal nerves, all the 31 dorsal roots have dorsal root ganglia, and they are located in the vertebral canal. Coming to the sympathetic ganglia, there are two sets of neurons in relation to the sympathetic nerve system. There is a preganglionic neurons which are located within the CNS, and the ganglionic neurons which are located within the ganglion. The typically sympathetic nerve system is considered as thoracolumbar outflow because the preganglionic neurons are located in the thoracic and upper 2 lumbar segments. The ganglia are located closer to the central nerve system, that is closer to the spinal cord there, and these are made up of multipolar neurons having synapses with the preganglionic fibers. Because the ganglia are located closer to the CNS, the preganglionic fibers are shorter and the postganglionic fibers are longer because there is a greater distance between the ganglia and the viscerite supplies. So these are the preganglionic fibers reaching the sympathetic trunk, which is located just outside the vertebral canal on either side. Either they relay in the ganglia at the same level, or the fibers may ascend up and relay in the ganglia at the higher level, or the fibers may descend and relay in the ganglia at the lower level. Now from the sympathetic ganglia, they take one of these 3 routes. Either they go along with the ventral and dorsal rami. These are called as lateral branches, and they will reach all the blood vessels and sweat glands because sympathetic system has a pseudomotor and vasomotor supply function. Or they may pass without relaying in the ganglia as splanchnic nerves. These are called as medial branches, and they reach the viscera directly. En route, they relay in a ganglion. Or the third route is they exit as anterior branches, and they reach the first available blood vessel, and then they travel along with the blood vessel in their wall, being a predominantly vasomotor in function. Coming to the parasympathetic ganglia, these are called as craniosacral outflow. Again, they have two sets of neurons, a preganglionic neurons and the ganglionic neurons. It's called as craniosacral because the preganglionic neurons are located either in the brain or in the sacral part, S2, S3 and S4 segments. The ganglia here are closer to the effector organ and again made up of multipolar neurons. Within the ganglion, the preganglionic nerve fiber will synapse with the ganglionic cells. But because the ganglia are closer to the viscera, there is a long preganglionic fiber and short postganglionic fiber. The preganglionic fiber, which is traveling with the third cranial nerve, relays in the ciliary ganglion and it supplies sphincter pupillae and ciliaris. The preganglionic fiber traveling with the seventh cranial nerve either relays in the pterygopalatal ganglion and supplies lacrimal gland, or relays in the submandibular ganglion and supplies submandibular and sublingual glands. The preganglionic fibers traveling with the ninth cranial nerve relays in the otic ganglion and supplies parotid gland. And the preganglionic fibers traveling with the vagus nerve relay in a series of ganglia and they supply thoracic and abdominal viscera. And the fibers coming out at the sacral level from S2, S3, S4 segment, they relay in the pelvic ganglia and supply the pelvic viscera. Enteric nervous system is made up of neurons and plexuses in the wall of the gastrointestinal tract. We see them as myenteric or Auerbach's plexus situated within the muscularis externa layer of the gut, and submucosal or Meissner's plexus located within the submucosal layer of the gut. They help in controlling peristaltic movements and glandular secretions. Thank you. Hope you go through this video carefully and understand the working of peripheral nervous system.